In order to add the diagnosis to the patient's chart, on the first page of the evaluation, it says Select Diagnosis. Click that on the right-hand side. It now opens up where you can search by either the name or the number. So, for example, if I type in here, start typing Parkinson's, it will find any ones that have that word in it. Do not use the codes that are in red. Those are no longer eligible diagnosis codes, so do not use those. Only use the codes that are in black. Click on the code and then add that to your medical or treatment diagnosis list, and it will be on the list. If it's a code you think you'll use frequently, you can click the little star and then you can build yourself a list of favorites. You can also search for the code by typing in the code number. Once you type in the code number, it will immediately find the code. Same thing, you can just highlight it and add it to your medical or treatment diagnosis list. And that's then how you add the codes to your list. If you ever have a code that you marked wrong, you need to delete it, just click the little trash can and it will be off of your list.